You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
So on today's show, we're going to talk about beauty products. And that is a really broad topic because there are so many different products, so many different ingredients, so many different formulations and combinations of products. It can be confusing to know if something is or isn't compatible for use during pregnancy or nursing. And it's so hard already to be pregnant for a lot of people. I mean, it's a very joyful time, but it can put a lot of stress on the body. It can put a lot of stress on the mind. And so even things that seem very simple, like, oh, should I get my hair done? Can I get my nails done? Becomes a stressful situation. So I think it's a really important question to answer. So we're going to jump right in. And on the line right now, we have Jackie. Jackie, are you with us?
I am, yes.
Great. Thank you so much for joining us today.
Of course.
Where are you located?
I'm calling in from Connecticut.
Oh, okay, great. And you have a 1-year-old child, is that right?
I do. She just turned 1 last week.
Oh, excellent. Well, happy belated birthday to her. So, in relation to beauty products, hair treatment, what question can we answer for you today?
Well, I think one of the most asked questions that I've received from some of the people in my fellow mom groups is that a lot of them get their hair dyed, and they're always kind of asking whether or not that's safe or it's something that they should or shouldn't be doing while they're pregnant, even while they're breastfeeding.
That's a really great question. We have Sharon Voyer Lavigne, a genetic counselor based in Connecticut. She is very knowledgeable. Sharon received her Bachelor's of Science in Biology from Northeastern University in 1989 and her Master's in Human Genetics from the Joan H. Marks Graduate Program in Human Genetics at Sarah Lawrence College in 1991. After completing her graduate degree, she worked as a prenatal genetic counselor at Bridgeport Hospital and the University of Connecticut. Go Huskies. In 1998, she became coordinator of MotherToBaby Connecticut. Sharon, what do you think?
I think it's a question we get an awful lot, and I just spoke to somebody last week who herself is a hairdresser and is pregnant and is going to be moving and relocating and wants to look around for a new job and wants to get her hair highlighted so she looks good, because you can't be a hairdresser without nice hair. And her question was, what do I do now because I'm pregnant? And I always say that I could talk to 3 different physicians and they're going to give me 3 different answers. One is going to say, nope, don't do it at all. One is going to say, don't do it in early pregnancy when all the organs are forming. And the third one's going to say, it's not a problem, do it at any time. It's an optional treatment. It's not a medically necessary process. So the woman, I always ask her, is this something you're going to worry about later? You might want to take that into consideration. If it's something that's going to be concerning for you later, then maybe it's best that you avoid it. But the literature, the information that we have so far does not suggest any significant increased risk if a woman gets her hair treated, whether it's a permanent or colors or dyes in pregnancy. There is information to suggest that what we do put on our scalp does get into our blood supply, and we've been able to detect it in urine in women who have had procedures done on their hair, or had treatments done on their hair. So we know that it does get into the system, but we don't have evidence to say that it's really going to be harmful. So again, it goes back to being a very personal decision, and what they feel most comfortable doing, whether they want to try to use a process that has the least amount of chemical touching their scalp. Some women choose that, and other women decide it's not something they want to do in pregnancy, or they don't want to do it regularly in pregnancy. So it comes down to really a very personal choice, I think, for most women.
Interesting. And you mentioned, something that we as teratogen information specialists talk about all the time, but I think something important to bring up is you said no increased risk. What does that refer to?
Well, we know that every time a couple gets pregnant, there's a chance they could have a baby with a birth defect. That's a risk for me, for you, for anyone. And that background risk is about 3 to 5% for all of us. And so when we're looking at this data, we're looking, does this exposure, whatever it happens to be, put that mom at higher risk to have a baby with a birth defect than she would have been without having that exposure?
So the good thing about 3 to 5% chance of having a birth defect in a pregnancy also on the flip side means that 95 to 97% of the time you're not expecting to see a birth defect in a pregnancy. And I think that that's a good thing to highlight, that, unfortunately at this point in the game of science, that there is nothing that's going to be guaranteed, nothing is going to be perfect. And so there is a risk, even if a woman lived in a bubble for 9 months and never even looked at a cup of coffee, never walked by a nail salon, didn't ever take 2 tabs of pain reliever, there's always going to be that small risk. So nothing is going to be guaranteed, but it's nice to know that products like hair dye and other beauty treatments of that nature are not thought to increase risks.
Right. That's very true.
So the other day we were talking about something a little bit different. If you recall, you had mentioned that you had a caller asking about Brazilian blowouts and something about formaldehyde, which the word by itself can invoke scary images. But what's the real scoop? Are Brazilian blowouts okay in pregnancy or breastfeeding?
Well, a Brazilian blowout is a treatment that includes the chemical formaldehyde, which is a chemical that we use as a preservative. So it's a chemical that you wouldn't want to necessarily come in contact with when you're pregnant in general, and can stop cells from dividing and growing. So it's a product that we use in embalming, so when, as a preservative for human bodies before we bury them. It's a product that we see in other chemical processes. And the process of the Brazilian blowout releases formaldehyde. So even it might not even list formaldehyde on the label, because hairdressers are, stylists will tell me that the formaldehyde, it's not listed on the product and the ingredients list. And that's true, but when the ingredients in the product are heated, it creates formaldehyde. So it doesn't need to be listed on the ingredients in that sense, and that's tricky. So you may look at the ingredients and say, hey, there's no formaldehyde in here, it's fine, it's safe, but when the process takes place, they're heating the hair and the agent that they put on your hair, and that's what's creating the formaldehyde. So we really want you to shy away or avoid coming in contact with that at any time in pregnancy.
What about breastfeeding?
Breastfeeding, I would say the same thing. The formaldehyde being such a potent chemical, we would want you to minimize or avoid your exposure to that at any stage. When you're trying to become pregnant, it might even be something that you would want to shy away from, as well as when you're breastfeeding.
So Sharon, what I'm hearing you say is that, until we have more information, at this point, we're not necessarily saying that there's going to be negative effects, but the truth of it is we don't really know if it's going to somehow have a harmful impact when pregnant or trying to get pregnant or when nursing. And so if possible, to avoid things like the Brazilian blowout, where they have these chemicals that when heat are applied can change into something different and something that's not really well studied in terms of pregnancy or breastfeeding. Is that a fair statement?
I think that's a fair statement. I think we want to err on the side of caution until we have more details. You're absolutely right. We don't know that it will be harmful, but we don't have the evidence to say that it's not going to be harmful either.
So, Jackie, do you have another question about beauty products and pregnancy or breastfeeding?
So I did have another question. While I was pregnant, somebody gave me a gift certificate to get a facial, but I do know that they use a lot of herbal products, so I was curious to know whether or not that was something I should be concerned about.
So that too is a timely and frequently asked question. And in fact, one of our previous podcasts were about the use of herbal ingredients and essential oils. So Sharon, what's your take on essential oil and herbal ingredients used in facials? Is that okay in pregnancy or breastfeeding, or is that a no-go?
I think in our last podcast we talked about how when we apply things to our skin, the amount that gets into our blood is not the same as if we were getting a vaccination or taking something by mouth. A facial would be, our skin is our largest organ, and just having products applied to the face is a very small area. I think if your skin is intact, meaning it's healthy, there's not any openings, you don't have a skin condition whereby your skin is damaged in such a way that the things that are being applied to your skin are going to be more likely to be absorbed. I think those are all factors that make the likelihood of it being a problem smaller. But on the flip side, what's in the products we'd want to know about. So there's, many, many, many different facial products on the market. And when you go in and have a facial, you may say, I need something that's moisturizing, or I have oily skin. So they're going to be using them based on what kind of skin type you have and what you're looking to gain from the facial. And so it would be important, I think, to know what the ingredients are in the product, what the active ingredients might be for whatever you're trying to gain from that procedure. And I think the bottom line with that is that there are going to be a lot of ingredients listed. Water is probably going to be the first one, but there are going to be a lot of ingredients listed for which we don't really have a whole lot of information to go by, which leads us again to not be able to be absolutely certain, is this going to be a problem or not?
So to piggyback on that, we actually have another caller, Gina from Connecticut. One of the great things about being a teratogen information specialist at MotherToBaby is that very often we get repeat callers. So callers who have called or contacted us once before and then have a different question or a different situation comes up. And so we're able to talk with them multiple times in a lot of cases and answer whatever questions they may have over time. Gina, who is a repeat caller, she was on a previous show about herbals and essential oils. And her question, Sharon, ties right into what you were saying about knowing what products are in and if there are any that are truly going to be considered an issue. Because like we talked about before, many, many products, many different formulations. Sometimes there are things like proprietary blend when you don't know exactly how much of what ingredient is in there. But there are a select few ingredients that we know and we would absolutely suggest be avoided in pregnancy and breastfeeding. So Gina, welcome back to the show. How are you doing?
I'm doing great. Thank you for having me back.
Oh, great. Our pleasure. So what questions do you have that we can help you with today?
So there are certain times throughout my pregnancies that I have experienced some sort of acne. And I actually have friends who complain about getting this, that certain acne that you get when you're pregnant. Now, I have friends who are on Accutane that we constantly talk about what's safe, what's not safe. Is Accutane safe? Is benzoyl peroxide a safe product to use on acne while pregnant? Or is there another ingredient that we should be looking for or avoiding when these breakouts occur?
Well, Gina, bringing up Accutane is a great question. Accutane is one of the manufacturer names for a product called isotretinoin, and that's a very potent version of vitamin A. We use it in individuals who have cystic acne. It's not a first-line treatment, so usually it's something someone has gone to see a specialist, a dermatologist, to talk about treatments for their acne, and they've tried other treatments, and then they resort to the isotretinoin. That's a product that's been very well studied that we feel that is not safe to use during pregnancy. And in fact, there's a whole pregnancy prevention process that you would go through if you get a prescription for that. So what happens is you have to use 2 forms of birth control. You're given 1 month at a time of prescription, and when you refill the prescription every time, you're going to have a pregnancy test because it is so high risk. So that's definitely a product that works really well. It's a great medication, and it has great use for a lot of individuals, but not during pregnancy. So it's something you have to be very careful about. And typically we want you to be off about a month before you try to conceive. The medication is probably out of your system within 10 days or so, but I think the standard is to wait about a month or one cycle before you try to conceive. So that's definitely one that we would want to avoid. Accutane has been shown to cause an increased risk for pregnancy loss, um, maybe as high as 40%, which is very high risk, compared to the background rate of about 15 to 20% rate of miscarriage for any pregnant woman. And the other issue, it has a very increased risk for birth defects if you're using it early in pregnancy. It can cause birth defects of the heart, eyes, ears, brain. So it really can cause some serious birth defects in individuals who've been exposed at any time in pregnancy, but especially early on in pregnancy when you maybe aren't certain that you're pregnant right away.
Sure, and that makes sense because it's during that first trimester, so those first 12 or 13 weeks, where the fetus is doing a lot of growing and a lot of the organs and the body systems are starting to develop at that time. And I think that's why, even when we don't have a lot of information, we use caution when people are using a lot of different things in the first trimester. But as you say, any time in pregnancy for Accutane, if it affects the brain, because the brain grows throughout pregnancy. And so the risk may not be the same as if someone was using it in the first trimester, but it's still not going to be recommended at any time in pregnancy.
Absolutely. Brain is forming throughout pregnancy, so there would never be a safe time to be exposed to this medication.
An interesting fact for our listeners out there, another member of the MotherToBaby family, Dee Quinn, who originally started out in Connecticut before you did, Sharon, if I'm recalling correctly. And Dee Quinn is the founder of the MotherToBaby Arizona service, where I'm currently coordinator. She testified in front of the FDA about Accutane years ago, after this data had come out, and looking to put a program in place that would allow women to safely use this medication when they're not pregnant or planning a pregnancy or breastfeeding. So I know that there are some members of MotherToBaby who have been instrumental in having this data not only brought to the forefront, but having it recognized and incorporated into the healthcare system in a way that would make products not only available, but also compatible when used correctly. And so, because I mentioned breastfeeding, that actually made me think of something else. So, what about Accutane in breastfeeding? Is that something that's going to be compatible?
That's a great question. Unfortunately, we don't have enough data yet to say. There haven't been any studies that are really looking at how much of that medication, if any, gets into breast milk. I think we would still err on the side of caution, and that if a woman needs to use the isotretinoin for a period of time, that it not overlap while she's nursing.
Okay, so now that we've gotten the Accutane question out of the way, I do want to revisit what Gina had said. She asked about benzoyl peroxide, which I know is also a topical, doesn't seem to be in the same category of Accutane. So Sharon, what would you say about that?
You're absolutely right. Benzoyl peroxide is topically used, whereas the isotretinoin was in pill form. So you're going to get less into your system using it topically. Probably only about 5% that you apply to the skin is going to be absorbed into the body. We're not seeing evidence that this particular use of that product is going to significantly change your risk for birth defects if you need to use it during pregnancy. Some women only use it on their face, others may use it on larger areas, body surface areas, so we would probably want you to, use it limited.
Well, this is a new question. This is my fourth pregnancy, but being a little bit older now, I guess I never remembered using, anti-aging products or really specific skincare products when I was younger pregnant. But now that I'm older, I really questioned every single product that I was using. Of course, I questioned the products I was ingesting, but this was the first time I was really questioning my topical products. So I have questions regarding the ingredients and what I should be avoiding in, let's say, like a lash enhancer or specifically for my skin type was even a dark spot reducer that contained things like vitamin C and some of them even salicylic acid. Those were my concerns with specifically with my skincare products right now.
Salicylic acid is something we do want you to avoid topically because of a theoretical concern. So if that is something in some of your products at this time, at the end of pregnancy, I would suggest avoiding them if that's possible.
Well, salicylic acid is the chemical that we find in aspirin. And aspirin is something that we don't recommend that a pregnant woman use. And so we wanted to look at the topical use of it a little bit more closely. Again, it's topical. You're not going to absorb the same amount in the same way that you would if you were taking aspirin by mouth. So when we apply it to the skin, the amount that gets into our body is much less. And so for that reason, using it topically, it's probably not going to significantly increase risk for any birth defects if a woman uses it during pregnancy.
And that's good news. And even though it isn't thought to increase the risk, we still, for all products really, are going to suggest that you use them as directed, either on the packaging label or as directed by your healthcare provider. Because for a lot of products, we want to use enough to have them be effective, which is what they call the therapeutic effect, but we don't want to use more than we have to. We don't want to expose ourselves or our fetuses or our nursing babies or children to anything more than we actually need to get the job done. So it's kind of like a use in moderation, use as directed, and the risks are thought to be low, which is good news because I think that when we don't have a lot of information about products, it becomes confusing and scary. And it's like, well, what can I use, or am I stuck not doing anything at all? And there is a happy middle ground in a lot of cases.
Okay, good to know.
So lash enhancer products have a couple issues. One is there are multiple ingredients, and the ingredients are different in the different products. And many of the ingredients are things that we haven't really studied yet in terms of what the risk could potentially be in a pregnancy or if they're used while nursing. How much is absorbed into the skin, how much gets into the blood, all of that, we don't really have those answers just yet. The second issue is how might this affect mom? If you're using it on your eyes, on your skin, near your eyes, are you going to have any unusual reaction to it? And so my suggestion would be, if that's something you're considering doing, that maybe you talk to your healthcare provider first to see if that's a product that may be, harmful in some way before you use it.
And I think I recall hearing something about some formulation, one product, or maybe more than one, where there were some side effects noted because, there are always going to be the risk for side effects. But if I recall correctly, there was an issue about there being more side effects than what either people had thought initially or more than the information that we originally had. So I would absolutely have to agree with you. I think that in pregnancy and breastfeeding, if it can be avoided, that may be the route that a woman wants to go. And if outside of pregnancy or not planning a pregnancy, consulting with your healthcare provider just to make sure that there's not any other risks that may not really be related to a pregnancy or a nursing baby, but risks for mom herself.
Listen, when you're pregnant, you have a lot of things to deal with that you have no control over. So if you can keep yourself from having any additional complications, that might make your life a little bit easier.
So the other part of Gina's question addressed vitamin C use that may be in some of these products. Of course, there are many ingredients, but I know vitamin C comes up frequently. So vitamin C, I know is, part of our regular diet. It's part of our prenatal vitamins. It's what we call a P vitamin, meaning that if you get more than your body's going to use, that it's just going to cycle back out. Gina, thank you so much for that question. And if you thought you were hearing a little bit of accompaniment, that would be my son, Arthur, who is a little bit over a year old at this time. He really wanted to be part of this podcast. So again, thank you so much for calling in. And remember that you are free to contact not just us through the podcast, but MotherToBaby at any time. Well, We have covered a lot of ground in today's show. So Sharon, thank you so much for being here, for lending us your expertise, helping our callers and me talk through these situations and answer these questions, because it is important to say that, you know, we certainly care about pregnancies, we care about fetuses, we care about children, and we care about mom. And who doesn't want to look beautiful and feel comfortable every day? And it's not always possible, you know, in everyday life, pregnant, breastfeeding, or not. You know, there are things that come up. But if there is something that we can do to make ourselves feel better about ourselves, that's compatible with all the other factors in our life, that's what we want to do. So we really appreciate the time that not only you, Sharon, but our callers, Gina and Jackie, have given us today to help us explore this a little further. So stay tuned, because we're going to have more episodes talking about other exposures during pregnancy and breastfeeding and whether or not they're safe and compatible. So things like marijuana, for example, other medications. And of course, if you ever have any questions and want to contact MotherToBaby directly, you can always reach us at our website at MotherToBaby.org. You can give us a call at 866-626-6847. You can shoot us a text by texting 855-999-3525, or by visiting our website. We also have a chat feature. So whatever way you want to contact MotherToBaby, we want to hear from you. Thank you. And just remember, MotherToBaby's here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.